So far, we've been talking about brain regions that are localized, but we know there's a lot of things that the brain does that are much more widespread. We may know some of the areas involved, the areas are distant from each other. So, we're going to look at what we'll call functional brain systems. These are networks that cover large areas of the brain. They're not little areas like Wernicke's area or Broca's area. And the two we'll look at are the limbic system and the reticular formation. So that limbic system has structures on the medial aspects of the cerebral hemispheres in the diencephalon. The fornix is a fiber tract that links the limbic system regions. It also includes parts of the diencephalon and some cerebral structures that encircle the brainstem. The limbic system is really part of our emotional or affective brain. Some of the important structures are the amygdaloid body, which we know from pathology and from functional studies is how we recognize angry or fearful facial expressions, helps us assess danger, and it's important in eliciting a fear response. Another one is the cingulate gyrus, which plays a role in our expressing emotions through gestures and helps resolve mental conflicts. So here you see many of the structures, and you notice they're all over many regions of the brain. They're not localized like we saw in our others. So the limbic system's overriding thing is to put emotional response to odors. For example, skunks smell bad. There's no chemical reason that a skunk should smell bad. We just interpret it that way. Most of the output from the limbic system is through the hypothalamus, and we know that perhaps the hypothalamus plays a role in psychosomatic illnesses. The limbic system interacts with the prefrontal lobes, which allows us to react emotionally to things we consciously understand to be happening. And it makes us consciously aware of emotions and gives us richness in our lives. The hippocampus and the amygdaloid body also have a role in memory. The reticular formation is going to go through the central core of the brainstem. There are three broad columns that run the length of the brainstem called the raphe nuclei, the medial group of nuclei, which are also called large cell, and the lateral, which are also called small cells group of nuclei. It's got axonal connections throughout the hypothalamus, the thalamus, the cerebral cortex, the cerebellum, the spinal cord. And its connections allow it to help govern brain arousal. So this reticular activating system, RAS, is going to send impulses to the cerebral cortex to keep it conscious and alert. It's going to filter out repetitive, familiar, or weak stimuli, which in reality is about 99% of all the stimuli that comes into our body. We filter it out. We don't pay attention to it. It's inhibited by sleep centers. It's inhibited by alcohol and other drugs. Severe injury to the reticular activating system can lead to a coma. Excuse me. Some of the motor functions of the reticular formation help us to control coarse limb movements through the reticulospinal tracts. And the reticular autonomic centers are going to regulate visceral motor functions. So we have vasomotor centers, cardiac centers, respiratory center. Very much a widespread structure that's very important in keeping us conscious and alert. Now, with all these structures And those two formations and many other formations, somehow we get our higher mental functions, things like language, memory, which we can measure with brain waves and EEGs. What is consciousness? How do we recognize consciousness in sleep-wake cycles? So language is our implementation system that's going to involve association cortex in the left hemisphere, and at least 90% of people. Some of the main areas would be Broca's area and Wernicke's area. Broca's area is involved in producing speech. So patients with lesions to Broca's area, patients with Broca's aphasia, understand words, but they can't say the words the way they want to make them. They talk as though they were saying a sentence, but they're using nonsense words because they can't form the words they want to know. In Wernicke's area, understanding spoken and written words. So patients with lesions in Wernicke's area, strokes or injuries, speak, but the words are nonsensible. There are also corresponding areas on the right side, or the left if you're left, for non-verbal language components. Memory is important to all of us. In fact, if you're in class, one of the most important things you could do is make memories of the topics, the ideas, the things that I've been trying to express to you over the course of the semester. So we're talking about storage and retrieval of information. And there are all kinds of different kinds of memories. Declarative memory would be facts, things like names, faces, words. Procedural memories are skills, playing the piano, playing the guitar. Motor memory of motor skills, things like riding a bike. An emotional memory of experience linked to an emotion. Your heart pounds when you hear a rattlesnake. I've never heard a rattlesnake except on TV, but I imagine my heart would pound. We know the most about getting declarative memory and retrieving declarative memory. To get that, we first have to have short-term memory or working memory. Short-term memory is the temporary holding of information. It's limited to 7 or 8 pieces of information, we believe, and it turns out that the people who came up with telephone numbers use this bit of information to give us our 7-digit phone numbers. So your area code, or your area code, and then your 4 numbers was supposed to help people be able to remember phone numbers. So 532-6015, for example. Long-term memory has an apparently limitless capacity, which is good news. We can keep filling it forever, but we've got to be able to get it back from long-term memory. And the things that help transfer short-term memory to long-term memory are emotional state. So alerted, motivated, surprised, aroused is one of the reasons I try to work in some very corny humor. So get you into listening a little bit. Rehearsal and repetition, so practice, homework. Tying new information with old memories. I try my best to find links between what we're talking about and what I think you may have encountered before. Remember the jelly roll of the Schwann cells. And then there is automatic memory, which is a subconscious information stored in our long-term memory. Memory consolidation involves fitting new facts into categories that are already stored in the cerebral cortex. The hippocampus, the temporal cortical areas, the thalamus, the prefrontal cortex, all involved in this consolidation. This is what we would, as lay people say, making connections between what we know and what we are learning. Homeostatic imbalances during damage to the hippocampus or surrounding temporal lobes on either side can result in only slight memory loss. However, bilateral destruction causes widespread amnesia. Unfortunately, we know this because patients with severe epilepsy were once treated by removing or the hippocampus, or hippocampus was damaged in the process, and they are not able to make new memories. So they have what is known as anterograde amnesia. Their consolidated memories are not lost. They have their memories they had, but they cannot make new memories. So the person lives in the here and now. Their memory is good for just about 5 minutes. You introduce yourself, leave the room, and come back. That person will not know you. Retrograde amnesia is loss of memories in the distant past. So brainwaves. Brainwaves reflect the electrical activity of higher mental functions. They're not really measures of higher mental function, but they're measures of the activity and the electrical activity in the brain going on while you are doing those. But normal brain functions are continuous and hard to measure. We use electroencephalogram, or EEG, to record the electrical activity that accompanies brain function. And we can use an EEG to do things like diagnose epilepsy and sleep disorders. It also can help you localize lesions, tumors, infarcts where blood has been blocked, infections or abscesses. It is used in research and also used to help determine what we would call brain death. The electrodes are placed on the scalp, and they measure electrical potentials between various cortical areas. Here's a person with an EEG. Those EEG patterns of neuronal activity are generated by the synaptic activity in the cortex. So each person's brainwaves are unique. I'm not saying there's a specific one. And the patterns you have change with age. They'll change with sensory stimuli and disease states in the chemical state of the body. EEGs measure frequency in hertz, which is a number of peaks per second. 1 hertz would be 1 peak per second. And using that hertz measurement, we classify brain waves into 4 categories: alpha, beta, theta, or delta waves. The alpha waves are between 8 and 13 hertz. They are regular and rhythmic with low amplitude. They are synchronous waves. They would indicate an idling brain. Your brain is just doing what it does without concentrating on something. Beta waves are between 14 and 30 hertz. They are still rhythmic, but they are less regular. They occur when we are mentally alert. Theta waves, 4 to 7 hertz, are more irregular. They are more common in children, and they are uncommon in adults who are awake. The delta waves, which are less than 4 hertz, are high amplitude waves of deep sleep when the reticular activating system is suppressed, such as during anesthesia, and they indicate brain damage if you have them when you are an awake adult. So here are examples of those waves. They really don't mean a lot to me, but someone who is used to reading EEGs can get a lot of information from these. Epileptic seizures are torrents of electrical discharges by groups of neurons that prevent any other messages from getting through. A patient with epilepsy, I hate victims, we don't have victims, we have patients, may lose consciousness, they fall stiffly, they may have uncontrollable jerking. Epilepsy is not associated with intellectual impairment. It occurs in approximately 1% of the population. Genetic factors we know play a role. Brain injuries, strokes, infections, or tumors can also be causes of epilepsy. They usually are preceded by an aura, a sensory hallucination, a sound, a smell. There are a couple of different kinds of seizures. It used to be called petit bal, now known as an absent seizure. It's mild in the sense that you don't shake around, but it's definitely a lack of consciousness. Their expression goes blank. They're awake, they're looking at you, but they're not aware of what's going on. So I really mild in the sense of physical activity, but it's just as severe as a tonic-clonic seizure physically. My daughter had absent seizures when she was young. The tonic-clonic seizures used to be called grand mal seizures. Those are the ones you're probably used to hearing about. They last up to a few minutes. Patients would lose consciousness, they convulsions, if they bump into something, can break bones, they probably lose bladder and bowel control. There is a slight danger of biting of the tongue, but in most cases, you would just allow the patient to have the seizure and make sure they're not bumping into things. And it's important to time the seizures when you have a patient who's having seizures. There are some drugs that can be used to control epilepsy. There's vagus nerve stimulator or deep brain stimulation implants that may help with stabilizing activity in epileptic patients. Consciousness. Consciousness is very easy to talk about. We can definitely tell when someone is not conscious. However, describing what consciousness is a much harder thing to do. We know consciousness involves our perception of sensation. It involves our voluntary initiation and control of movements. It involves the capabilities we associate with higher mental processing, memory, logic, judgment. We can't really say there are two sides to the coin, conscious and unconscious. We have a continuum that grades a level of consciousness, how well you can respond to stimuli, how alert you are, whether drowsy, stupor, or coma. So consciousness is a very active area of research, and how we achieve that, how our brains achieve that, is really an amazing thing. Currently, we have theories, lots of theories. It involves the simultaneous activity of large cortical areas. It's really superimposed on other neural activities, almost something that emerges from an active brain. And it's definitely a holistic, totally interconnected type of activity. All right, so except during sleep, loss of consciousness signals that brain function is impaired. Fainting or syncope is a brief loss of consciousness, most often due to inadequate cerebral blood flow. It can be due to low blood pressure or ischemia from a hemorrhage or sudden severe emotional stress. A coma is unconsciousness for an extended period. A coma is not the same as deep sleep. Oxygen consumption is lowered in a coma, for example. And brain death we would refer to as an irreversible coma. There are ethical and legal issues surrounding a decision of brain death, whether a person is dead or alive. It's good to know, good to you to learn that death is one of those things like consciousness, that it's not just here, on or off. Death is a process. Death is a process that takes a while to occur, and depending on the situation. So it's a process, it's not an instantaneous event. Sleep-wake. Sleep is partial unconsciousness from which we can be aroused by stimulation. Our cortical activity is depressed, but the brainstem activity doesn't change. Sleep comes in two major types: non-rapid eye movement and REM sleep. That's broken into 4 stages, and rapid eye movement or REM sleep. Pass through the first 2 stages of NREM during the first 30 to 45 minutes of sleep, and then move into stages 3 or 4, which are referred to as slow wave sleep. Here, the frequency of waves declines, but the amplitude increases. The EEG, heart rate, respiratory rate, blood pressure, GI motility would change. At about 90 minutes and the 4th stage ends, the REM sleep begins very abruptly. You get temporary paralysis except for eye movements. Oxygen consumption, heart rate, breathing increase. Increase could be greater than, to the point where they're greater than we are awake. And when we dream, it's usually during REM sleep. Sleep is regulated. We really don't know why. We really don't know what his purpose is, but it's not just humans. All mammals sleep. Most animals sleep. It's an alternating cycle of sleep and wakefulness that reflects their natural circadian rhythm, 24 hours, but actually, I think the actual cycle is less than 24 hours, which messes us up too when we start following clocks. So, reticular activating system activity is inhibited during sleep, but it is also the RAS that mediates sleep stages. The suprachiasmatic and the preoptic nuclei of the hypothalamus time the sleep cycles. Hypothalamus releases orexins that help the cortex to wake up. Typical sleep pattern alternates between REM and non-REM sleep. Here, if you follow the white line, would be through our stages over 7-hour sleep, 8-hour sleep. The importance of sleep. We don't know what it's for, but we do know that it's important. Slow wave sleep, stages 3 and 4, probably restorative. People deprived of REM sleep become moody and depressed, so the theories go that REM may give the brain an opportunity to analyze the day's events and work through emotional events or problems. It might eliminate synapses that were formed, so maybe we dream to forget. And our daily requirements for sleep decline with age. Stage 4 sleep declines steadily and may disappear after age 60. Clinically, we've got narcolepsy, which is a sleeping disorder involving the abrupt lapse into sleep from a wake state. Cataplexy is a related condition in which a person can lose muscle tone while awake. Orexins, the hypothalamic wake-up chemicals, probably destroyed by the patient's immune system. Orexin replacement is a possible treatment. That's still in the pipeline, however. Insomnia, on the other hand, is the chronic inability to obtain the amount or quality of sleep we need. Could be caused by depression, anxiety, excessive use of caffeine, computer, cell phone use too close to bedtime. Maybe in the future it will be treated by blocking orexin actions. All right, we're winding down on the brain. So protection of the brain. The meninges. Function of the meninges are to cover and protect the entire central nervous system, so it's part of the spinal cord, but we're going to start here in the brain. It contains cerebral spinal fluid, and it also forms partitions in the skull. Consists of 3 layers from external to internal: the dura mater, the arachnoid matter, and the pia mater. Dura mater is the tough mother, arachnoid matter is the spider mother, and pia mater is the gentle mother. So that dura mater is the strongest of the meninges. It's made up of 2 layers of fibrous connective tissue, a periosteal layer and a meningeal layer. The periosteal layer attaches to the inner surface of the skull, so it is only found in the brain, not in the spinal cord. And the meningeal layer is the true external covering of the brain. It extends into the vertebral canal as the spinal dura mater. The 2 layers are mostly fused, but they do separate in some regions to form the dural venous sinus, and sinuses collect venous blood from the brain and empty it into the jugular veins of the neck. So we'll talk about sinuses a couple more times this year. They take blood from venous blood and put it into more venous blood, from arterial to venous to So that dura mater extends inwards in several areas that form flat partitions that divide the cranial cavity. They are referred to as dural septa. They help to limit excessive movement of the brain. The 3 main septa are the falx cerebri, the falx cerebelli, and the tentorum cerebelli. So the falx cerebri is the longitudinal fissure attached to the crista galli. The falx cerebelli forms the vermis of the cerebellum, and the tentorum cerebelli is a horizontal dural fold over the cranium, over the cerebellum and transverse fissure. The arachnoid matter is the middle layer. It has spider web-like extensions separated from the dura mater by the subdural space. The subarachnoid space contains cerebral spinal fluid and the largest blood vessels of the brain. The arachnoid granulations protrude through the dura mater into the superior sagittal sinus. This is where cerebral spinal fluid is reabsorbed back into the blood, venous blood. The innermost layer, the delicate layer, is the pia mater. It clings tightly to the brain, follows all the convolutions. It has many tiny blood vessels that feed the brain. Meningitis is an inflammation of the meninges, which may spread to the central nervous system, which could lead to inflammation of the brain, which would be referred to as encephalitis. Meningitis is usually diagnosed by observing microbes in a sample of cerebral spinal fluid that we get from a procedure known as a lumbar puncture, commonly referred to as a spinal tap. That cerebral spinal fluid forms a liquid cushion of constant volume around the brain. So it gives buoyancy to the central nervous system. They're really floating in cerebral spinal fluid. It protects the central nervous system from blows and other traumas, cushioning it, nourishes the brain, and carries chemical signals for us. It's a watery solution formed from blood plasma, but has less protein and a different ion concentration than plasma. Choroid plexus is a cluster of capillaries that hang from the roof of each ventricle, enclosed by pia mater surrounding a layer of epidermal cells. Cerebral spinal fluid is filtered from the plexus at a constant rate. Epidermal cells use ion pumps to control the composition of cerebral spinal fluid and help cleanse cerebral spinal fluid by removing waste. And the cilia of the epidermal cells help keep the cerebral spinal fluid in motion. The volume of a normal adult is about 150 mLs, which is approximately a quarter of a bottle of water, and it's replaced every 8 hours. Hydrocephalus is an obstruction that blocks cerebral spinal fluid circulation and drainage, which results in increased pressure. Because the skull bones are unformed and are unfused and still pliable in newborns, that increased pressure can allow the head to enlarge, kind of like blowing up a balloon. But in adults, the rigidity of the skull will keep that pressure within, and that can lead to brain damage, can compress blood vessels and crush off soft nervous tissue. The only treatment is to drain cerebral spinal fluid with a ventricular shunt to the abdominal cavity. And this is an image of an infant that is suffering from hydrocephalus. So a stent will be put in to filter that fluid down to their abdominal cavity. The blood-brain barrier is helping to maintain a stable environment for the brain. So chemical variations that happen in plasma can be very detrimental to neurons. So substances from the blood must first pass through a continuous endothelium capillary walls before getting entry into the neurons. Those capillaries are the least leakiest of all the capillaries. They have very tight junctions to ensure substances pass through, not around the endothelial cells. The feet of astrocytes and smooth muscle cells like periocytes surround the endothelial cells. They help to promote tight junctions in the formation of endothelial cells. So substances can get through endothelial cells by simple diffusion if they are lipid soluble, or the blood gases are small enough, or they must have specific transport mechanisms. Facilitated diffusion can move important things such as glucose and amino acids and specific ions. Transcytosis, taking something on one side of the cell, moving across the cell and releasing it on the other, would be used for larger substances to get in and out of the brain. So that thick basement membrane surrounding the capillary is the last part of the barrier that substance have to get through. It contains enzymes that destroy certain chemicals that would activate brain neurons. It is absent in some areas, such as the vomiting center and the hypothalamus. And that's necessary to monitor the chemical composition and temperature of blood. And I'm going to stop there and pick up brain injuries and disorders and then finish up with the spinal cord.